Now, live from KUSI, this is Good Business San Diego. Sponsored by Wilsey Asset Management.
Hi, I'm Roy Robertson. Welcome to Good Business San Diego, where we're putting you first, talking about what's most important to you, your community, your home, your family, and your health. And the following is brought to you by Family Health Centers of San Diego. From comprehensive primary care to cardiology to dental services, Family Health Centers of San Diego cares for tens of thousands of people each year, regardless of income or insurance status. So today we welcome Keith Lyons, who is a licensed clinical social worker and mental health manager at Family Health Centers of San Diego, and Meredith Johnston, their Vice President of Development, to talk about how they're addressing the need for behavioral and mental health care. So important. Thank you both for coming in. So Keith, let me start with you. I understand this is National Mental Health Awareness Month. So
Yes.
Talk about the importance of this message and introducing viewers to what it is that you're doing for people in the community.
Yeah, so a lot of it is just about awareness. We have a lot of attention on physical health, and we kind of put mental health to the side, right? The first things to go are sleep, social time, exercise. These are all things that contribute to mental health, but they also impact physical health, relationships, ability to interact in the community. So raising awareness, especially with everything that's going on in the environment, with anything from politics to all the changes that we're seeing, people are stressed more than ever, and I think it's hard for them to remember that they need to focus on mental as well as body.
So it's these influences that we're feeling that are definitely contributing to how it is that we're feeling.
Yes.
And maybe seeking out the need for treatment because it gets to be so extreme. Maybe it wasn't a couple of years ago, maybe it is now. So
Yes.
What are you doing to address these needs at Family Health Center?
So we try to meet the clients where they are. We are a community-based program, so we try to remember that at everything else. These are people that need access to care that's not limited by financial, blockades. So we have a lot of integration with primary care. We incorporate different services. We have departments that focus specifically for multicultural refugee populations. We have a lot of bilingual therapists. So yes, we tie everything together, dental, physical, and mental, and focus on the whole body for the client and try and keep them away from those barriers that are financial or location-based.
Really so important when you talk about this integrated level of care that you're able to offer, because you can't just isolate one aspect of healthcare.
Yes.
Healthcare is overall. How do you address that?
So we have them in-house. They can connect not only with mental health when they're there, but they can also be with their primary care. They can be with physical therapy, any other services. And the providers that they're working with are also able to see all of that information so that it does keep a holistic approach to them. And we're making decisions based on decisions that were part of other departments as well. So everything in-house, they don't have to get lost in the shuffle going to different areas.
How does somebody begin the process if they are looking for support?
Yeah, they can just call in, and actually we have a behavioral health referral staff. All they do is focus on getting people in the door and getting them connected with what they need, and then from there they just get continually connected to other services as they need, as the provider sees fit.
Excellent. Meredith, let me turn to you. I know that this Friday is the Spirit of the Barrio Luncheon, which is a big event for y'all, focusing on mental and behavioral health care. So tell us a little bit more about that. What do people need to know?
It's a vibrant, phenomenal luncheon. The tamales are amazing. We have a wonderful panel and moderator pulled together. I think it's going to be a really, really thoughtful discussion on an important topic about community resilience. Tickets are only $25, and we would love for the community to come out and be a part of the conversation.
What would you like people to take away from the experience of going to Spirit of the Barrio?
Oh, that's such a great question. I mean, I hope that they come away uplifted by how much phenomenal work goes into mental health in San Diego, our community partners, our services. There's a lot that's going on, and I hope they leave inspired and motivated.
So this is a month when we are trying to bring awareness to these issues. How can people in the community generally get involved, if not going to the luncheon? But in what other ways can they support what you're able to do?
I mean, I always go to philanthropy. Philanthropy enables us to do more than just insurance or public funding provides. It enables us to do innovative solutions and reach beyond just those basic services and ensure that mental health care in San Diego is not only available, but equitable and sustainable in our important communities, because they're fragile and they need it.
Yeah, absolutely. Thank you both for everything that you're doing in the community. Thanks for being here today.
Thank you.
Thank you very much, Roy.
You'll find all the information about everything that they're doing at Family Health Centers at fhcsd.org. Alphabet soup. fhcsd.org. We'll be right back.